There has been some epidemiological evidence, and when I say epidemiological, what I mean is looking back over a patient's history once let's say they have the diagnosis of Alzheimer's disease. You take a long history of what their educational level is, what drugs they've been on during their life, and you can pull apart different risk factors to try and see whether there is an association between them having the disease and something else they've done in their life. And if you do that, you do see some trend for educational level to be beneficial in preventing Alzheimer's disease. And this comes down to the old story of the more you have to lose before you see any impact on memory. So someone with a PhD, for instance, supposedly has a lower risk of developing Alzheimer's disease than someone who didn't graduate high school. But I think the more common thinking now is not so much just your educational level, but your continuing education through life. And if you're an avid reader, if you are a teacher, let's say, who has to keep up on things throughout their life, you seem to be somewhat protected from Alzheimer's disease. Now, that's not saying that you're not going to get it. Again, this is really just trending, and some studies really do show it well, and other studies really don't show an effect. So it's not a bad thing to have an education, but at the same time, I can't say for sure that yes, it prevents Alzheimer's disease.